Hi, it's Richard from Achilles Sports Therapy, just doing a quick tutorial on ice treatment in a cooler box or a bucket for anything such as Achilles Tendinitis, Plantar Fasciitis or ankle sprains, anything where you've got inflammation or swelling in the lower leg, ankle, etc. What I tend to do, get a big bucket that you can either put 1 foot or both feet in, half fill it with cold water, and then you've got an option, either just use the cold water, you can use either half a bag of regular ice, so cost you about £1 from the supermarket. You can also use the blue freezer blocks. So if you don't happen to have ice in your freezer, then these will do. If you're looking to actually get the temperature of the water down, then you could leave that for 5-10 minutes to actually allow some of the ice to melt, for the freezer blocks to actually bring the temperature of the water down, and then you'll find that the experience that you get from putting your feet into ice cold water is a bit of a shock to the system to start with, and you might find that you get a very heavy aching sensation for the first 60 to 90 seconds, but you're looking to immerse the foot in the water for approximately 6 to 8 minutes, which will constrict the blood vessels, it will get the inflammation down, it sends cold signals to your central nervous system as opposed to pain signals. Another option that you've got is that you can actually look to maybe put a bowl of warm water next to the cold, so that when you've finished the 6 minutes in the ice bucket, you can just go to not hot water, definitely not, warm water, just to bring the temperature of the foot back up. If you left it sort of normal, to allow your body to bring the feet back to normal temperature, it might take an hour or so. Okay, so if you immerse the foot in the cold water, so this is something that you'll find that it builds. So to start with, you won't really get much of a sensation. After 5-10 seconds, you'll start to feel that heavy ache in the foot. If the water's really cold, it'll feel like an animal's trying to bite your foot off. But persevere. If you get that really heavy ache, then try and stick it out. You might find that you've got to do some sort of breathing exercises in order to sort of bring things under control a little bit. After 60-90 seconds, you might want to move your foot around, because it's a bit like a wetsuit, where you've got a layer of water around the outside of the skin, and then that starts to warm, and unless you move the water around, you're going to get some slightly warmer water around the injury site. So if you move the foot, again, you'll feel quite a heavy aching, kind of a gnawing sensation into the foot. But if you've got Achilles tendinitis, and you've had it kind of assessed by a therapist, then as long as it's structurally sound, but you're just suffering with tendinitis, then I would look to do an ice treatment twice a day. So you could do this whilst you're eating your breakfast, and again at night when you're eating your dinner. And what you'll find is that the reduction in the swelling and the pain that you're getting from the tendinitis will start to reduce. So use that in conjunction with other therapies, whether that's electrical or physical therapy, things like kinesiology tape. Normally when people have got just mild Achilles tendinitis, it's annoying. If you've got an ankle sprain, then obviously you're probably going to not be doing physical activity, but you might want to kind of bring that swelling under control so that you've got less pain, less swelling in the joint. Allows a little bit more freedom of movement, and certainly with plantar fasciitis, it's the tendon on the underside of the foot that is inflamed. So this type of treatment, in conjunction with rolling on a tennis ball or something similar, is going to improve the health of the plantar fascia and give you easier sort of freedom of movement So try that out. Like I say, 6 to 8 minutes is going to be sufficient. Allow the foot to warm back up again. Give it a try, see how you get on, and leave me some comments. Okay, thank you.